is admitted with suspected myocardial infarction, which nursing action should the nurse perform first? Okay, the key word here is first. Please make sure we are seeing lot of all of the above. So please, if you guys can make sure we are. What is the priority action that nurse should perform first? Is applying oxygen is priority in suspected myocardial infarction? What about A, guys? We will go through each option. CBA. Guys, we know is suspected. Is it priority? There is no indication about patient is hypoxic or not in questions. In real world, we will definitely see. Okay. Yeah. There is no indication about hypoxia. Myocardial infarction is not confirmed diagnosis yet. So is applying oxygen is a priority? Is a priority? No. Yeah. Okay. So A is wrong. Placing the patient on cardiac monitoring, is that priority in suspected myocardial infarction? Yeah, this is the one of the crucial first step. Okay, because we need continuous cardiac monitoring, especially to detect the lethal dysarrhythmias. Like if somebody is going through the VF, we need to. Okay, so B is correct answer. Give nitroglycerin sublingually. What about C, guys? Do we need to give nitroglycerin if it is suspected myocardial infarction? Yeah. Okay. Again, yes. Again, the thing is that we don't have any indication about pain. We don't have any indication about blood pressure in the question itself. So we are not gonna go for C also. Okay. C is wrong here, especially if we will say yes, Ruth, definitely. Okay. So we are not gonna go for C. We don't have anything confirmed yet. Righty. What about D? Obtain a 12 lead ECG. Is ECG gonna help us with anything in myocardial infarction? Yes. Okay, because we need to know what's going on, whether it's STEMI or non-STEMI. Okay, so D is definitely correct. Encourage ambulation. What about E? Can we request patient to ambulate? No. Yeah. Okay. Yeah. The thing is that, like, if you are asking patient with suspected myocardial infarction to ambulate, it's gonna increase the myocardial oxygen demand. Okay, so that's high. That's why we need to look for that one and not encourage. Okay. Yeah. Yeah, it says sudden severe chest pain, but it doesn't say what's going on. Okay. Draw blood for troponin. F. Is it priority? Is F is priority? Yeah. F is only last priority to, like, we need to check troponin. We need to check whether there is some damage happen or not. But it's not gonna make anything. Yeah, yes. Yeah. It's gonna let us know like how much it increase, and it's definitely gonna help us with the diagnosis. Okay. What other test usually we can do if somebody is suspected with myocardial infarction where troponin is less? What else we can do? Is there any other blood test? Myoglobin, yeah, D dimers, yeah. Okay, let's move to question number 2, guys. So correct answer is B, D, and F. Okay, so let's move to next one. Okay, the nurse is monitoring a patient receiving thrombolytic therapy for acute myocardial infarction. Which finding indicate complication? Question number 2. So we already have patient who have acute MI and going through thrombolytic therapy. Okay, we need to find out what is complication in this one. What about hematuria? Is hematuria complication? Yeah. E. Yes, because patient is receiving thrombolytic therapy. Okay, so hematuria is complication, blood in urine, direct sign of bleeding. Okay, what about B, guys? Decreased level of consciousness. Can we see decreased level of consciousness in any condition like where with thrombolytic therapy? Yeah, yes, because sometime it can lead to intracranial hemorrhage, and that's the most feared complication. Like, we need to be very careful about that. Sudden severe headache. Yeah, sudden severe headache. Same thing. Yeah, okay, same thing. If there is a brain bleeding going on, okay, that's why C is correct also. Oozing at IV site. It depends. D can depend like upon quantity, upon like how excessive it is. So it should be monitored, it should be reported. I know we say it's only oozing, but it can increase. Okay, so we're gonna say it as a complication also. All right, what about E? ST segment resolution on ECG. Sorry, E. No, yeah, because this is the one of the thing that we want. That's why we are giving thrombolytic therapy to patient. Okay, so if ST segment is getting better, that means medication is working. Yeah, so this is blood flow have been restored to myocardium. We want that. Just Jessica, we want that. Okay, so E is wrong. And bloody stool, if patient is having melena, if patient is having FES, yes, definitely. Okay, bleeding in GI tract. Yeah, so we need to just worry about all these complications. Okay, let's move to question number 3. A patient with an acute MI is ordered several interventions. Which one should the nurse question? Select all that apply. Hello guys. Morphine IV for pain, or ambulation to the bathroom. What about A, guys? Morphine. B, yes, lot of B's. That's good. Is acute myocardial infarction and is ordered several intervention. Yeah, B. Okay, morphine is okay. Morphine is actually first. Yeah, so we don't need to question morphine. Okay, ambulation to the bathroom. B. Are we gonna question that one? A, C, D, E, F. Yes, because we just talked in last question about that. If patient is ambulating, especially after MI, is gonna increase the workload to myocardium. So we don't want that. Okay, definitely we're gonna question B because it can increase the severity of MI. Okay, aspirin 325 mg chewable. Are we gonna question that, or is it appropriate? Yes, Jacqueline. No. Okay. So this is one of the essential intervention, and it is not overdosed. It is gonna help with the MI treatment. It's okay. Okay. It's gonna prevent further formation of clots in coronary arteries. Okay. Oxygen 2 liter via nasal cannula. Are we gonna question that, or is it helpful? Is appropriate? Is helpful for patient? Yes. Okay. So oxygen is good. Is we are not gonna question that one also. Oxygen, morphine, oxygen. Yeah, nitroglycerin, aspirin. Okay, continuous ECG monitoring. We want that. Everyone happy with that? Cody oxygen is not always good for patient, but this is actually related to the patient about that. Yeah, continuous ECG monitoring we require, so we are not gonna question that one also. Okay, and F is nitroglycerin sublingual as needed. What about F, guys? It's only PRN medication. We can give it as required. We don't need to worry about that. It's charted, it's there, so it's fine. Yes, definitely. Okay, so we are only gonna question ambulation to bathroom because we know it's gonna increase the severity of MI. Okay, so definitely we will. Yeah. Okay, let's move to question number 4. So after percutaneous coronary intervention, which finding require immediate actions? New chest pain, and you don't agree with F. Why? Why, Kareen? Is nitroglycerin sublingual as needed only? Okay, we can give according to protocol. We can give according to protocol. Yeah. Please do write why you don't agree. So it's good to know. It's good to learn. We don't know everything. So yeah. Yeah. But it's not also saying like when they chart the PRN also as needed, you always go through the protocol. Okay, even if it is chartered. Yeah. Yes, Austin, posterior MI, but it's not written posterior MI. Okay, the only thing is that we are just doing according to the context of question. Yeah, in the real life scenario, lot can happen. There can be different things. Patient can be allergic to nitroglycerin. We can't give at all. If yeah, so we just need to stay within the question. That's the only way. If it is not resolved after third carine, then it's not angina. This is definite myocardial infarction on going over there. Okay, most of the time nitroglycerin will help with angina pain. Yeah, not complete MI. Yeah. So that's what good. Thank you, Bani. Okay, question number 4, guys. Yeah, after percutaneous coronary intervention, which finding require immediate action? New chest pain, absence of pedal pulse, severe back pain, hypotension, small ecchymosis at insertion site, and slight groin tenderness. What about a new chest pain? Definitely, yeah, because we have PCI already, and then it can indicate like there is a thrombosis, especially at the stent, and it can indicate also like there is a reocclusion of the arteries, so that means that can be the new MI. Okay. Absence of pedal pulses. What about B? Yeah, so yeah, lot of B's, yes. Because again it can also indicate that there is a clot formation in the arteries, so that's why we can't feel the pedal pulse. Severe back pain. What about C? C, yes. Yeah, see, definitely yes, because it is, especially it is the classical sign, of hemorrhage when we have like blood leak from the femoral artery access site, retroperitoneal spaces like those. So severe back pain need to be assessed. We need to see if there is any hemorrhage going over there. What about hypotension? Why we can have hypotension after PCI? What can happen there? D, yes. Because if patient is going through internal bleeding and we are having low cardiac output, it can cause hypovolemia, and that's why we can have hypotension. Okay. Yeah, hypovolemic shock, definitely. Okay, E, small ecchymosis at insertion site. Is that normal? Or is it, yeah, E is expected. Okay, E is expected, so we don't need to worry about that. And slight groin tenderness, especially post procedure. Yes, it is small, and again groin tenderness, they are saying it's slight, so that's also normal. Okay, and expected. So only correct answer is A, B, C, and D. Yeah. Okay, let's move to question number 5. The nurse is providing discharge teaching after MI. Which statement indicate correct understanding? Select all that apply. So teaching is very important, we know, because patient need to be adhere to lifestyle modification, to medications, to diet, especially after MI. So it is very important. Okay, I will stop smoking. Is it correct if patient is saying I will start smoking? Because we know, yes, smoking gonna increase the damage of blood vessels. It can increase the atherosclerosis, so that's why A is correct. I should avoid heavy lifting until cleared. What about B, guys? Yes, we just done B because we know exercise gonna increase the cardiac overload, cardiac workload, and it can strain the heart. Yeah, so we wanna make sure like, and especially when it's written like until cleared, that's good one. I will take my beta blocker even if I feel fine. What about C? Yeah, is C correct? Yes, C is correct. Because you don't know when blood pressure can increase. Okay, so they need to be adherent to the medication, to the routine medication. Okay, and so it can help. It can reduce the myocardial oxygen demand. It can prevent cardiac remodeling. So that's why C is good. um Next one, I can return to sexual activity when I can climb 2 flights of stair without symptoms. What about D? JJ, this is we are just doing the cardiac vascular NCLEX review today. Just for D, definitely D is yes, guys. D is yes. Okay, this is standard and safe guideline. Okay, because you again need, yeah, yeah, we need definitely. That's the standard. Okay, you need to climb at least 2 flight of stairs without symptom. If you are feeling exertion, that means you are having cardiac overload again, cardiac workload again, and we don't want to put strain to the cardiac muscles. Okay, so D is correct also in this one. What about E? I should only take aspirin if I have chest pain. What about E, guys? Yeah. Is aspirin for long term or short term? Aspirin is long term, okay? That is our daily medication that help to prevent platelet aggregation. So long term, yes. Thank you, Res. So E is incorrect. E is definitely patient need fit more education and understanding. I will report chest pain not relieved by nitroglycerin. Yeah. What about F, guys? Yes, because it indicating same like we discussed in last question, like potential acute attack is happening again. It can be unstable angina or it can be infarction. Yeah, so it does need immediate medical attention. So this is correct. Patient need to report that one. Alrighty. Let's move to question number 6. We have 50 questions in this session. Let's see how we are doing and then we will keep going. Okay. Hopefully we can do all 50 today. And the last prioritization and pharma is already uploaded on our YouTube channel. So if you missed that live, please subscribe to Nursingi at YouTube. Just search this one. A patient with acute decompensated heart failure is admitted. Which intervention should the nurse anticipate? Select all that apply. What is acute decompensated heart failure, guys? What can be the primary issue over there? Just simple manifestation. Anyone? CHF? Yeah. Fluid overload? Yes, risk, definitely. Okay. Acute decompensated heart failure is mainly characterized by fluid overload, especially the sudden one. All right. And that's how it lead to pulmonary congestion. And that's our goal. That's our goal should be to improve the oxygenation, to remove the excess fluid. Okay. So that's how we are gonna now discuss which interventions are anticipated. High follow position. What about A, guys? If we are putting patient into high follow position, it is gonna reduce the fluid from chest. Yes. Okay. Especially using the gravity, it will bring the blood down in lower extremities and it will reduce the venous return to the heart and it can help to reduce the pulmonary congestion. So A is correct. What about B, oxygen administration? Is B correct? Thank you guys for double tapping and sharing. Really appreciate. Yes. Okay. Because like again we done before. If we are having appropriate oxygen therapy, it will help to improve the gas exchange and reduce the dyspnea. C. IV furosemide. C, yes. Likewise, we already talk about that. Because in acute decompensated, we have sudden surge of fluid, so we want fluid out from body. Okay, and furosemide is loop diuretic, like we discussed in our last live on pharma. It can cause rapid fluid excretion and reduce the intravascular volume. Okay, and definitely that's gonna help us. Yeah. Okay, next one. 1 liter normal saline bolus. Is it appropriate to give to patient who already having fluid overload? No. Okay. So we want to get rid of fluid and we really don't want to give it. Yeah. Strict intake and output. What about E, guys? E is yes. E is definitely yes. Yeah, because that's how we gonna monitor whether it's medication, like especially we are giving furosemide, if it is effective or not effective. So just to maintain the fluid balance, we will do the E. And F, yes, daily weight, correct, because this is the most reliable indicator of fluid status. Yes. Because they say, like, if there is a 1 liter 1 kg change in patient weight, that is nearly equivalent to 1 liter of loss of fluid from the body. So that's why we really want to make sure like F is happening, and normally it's charted in daily chart. So that's why it's very important. Thank you, Ru. Okay, let's move to question number 7. Which assessment finding are consistent with left-sided heart failure? What is left-sided heart failure, guys? What's happening when left-sided can't pump the blood enough? What's happening? Where it is getting accumulated? Left-sided lung side? Yeah, definitely pulmonary. Okay, so that's why we're gonna see if all the symptom, all the assessment is gonna affect the pulmonary and lungs or not. Okay, pulmonary crackles. When we gonna see crackles, where it is fluid accumulating in lungs? Yes, okay, especially in the alveoli and lung interstitium. So that's why we will see pulmonary crackle. Okay, we done pink frothy sputum in our last live also. Why we can see pink frothy sputum in pulmonary system? What's happening over there? What's happening with B? CHF, yeah. Tiny micro. PE, yes. Okay, there is only two things that can cause pink frothy sputum, and it is very common question in NCLEX also, guys. So make sure we discuss about this, that they will always ask you this question most of the time. Okay, so we are gonna have pulmonary edema, severe pulmonary edema, that is gonna cause like, indicating like fluid, red blood cell have been there and is coming out from the pulmonary capillaries. So definitely that's why you will see pink frothy sputum, and make sure we always remember that one. What about C, jugular vein distension? Is it sign jugular vein distension? Is it sign of left-sided heart failure? No. Yeah. Okay. This is not the sign of left-sided heart failure. Right-sided, yes. Okay. Because when we have right-sided heart failure, there is accumulation of blood into systematic venous system, not into the lungs. Okay. Because right side receive blood from all body. Okay, that's why we gonna see jugular vein distension in RHF, not LHF. Okay, what about orthopnea? What about D, guys? Is D correct? Yes, share. Yes, D correct. Okay, because we are having shortness of breath, we are having pulmonary edema, um, especially you know when patient is lying flat. So supine position not good. Okay, so that's why it can increase the pulmonary congestion. That's why we always put patient into semi-forward positions. Okay. Um. Yeah. USMLE definitely, but that will be a bit more later on. Yeah, not in all the cases. Okay, D is correct. What about peripheral edema? What about peripheral edema? Can we see peripheral edema in left-sided heart failure? No, it is common symptom of right-sided heart failure. Okay, like same jugular vein distension and peripheral edema we will see in right-sided. Okay, and dyspnea on exertion we will see F. Yes, we will definitely see yes F, because now heart is overworking. It can't increase the output to meet the oxygen demand, and it can lead to shortness of breath. Yeah, heart is failing. Okay, so F is yes. We're gonna see dyspnea on exertion. So correct answer is pulmonary crackle. We will see pink frothy sputum from edema and leakage of blood into the lungs, alveoli, and orthopnea and dyspnea on exertion. Okay, let's move to question number 8. Yeah. The nurse care for a patient with right-sided heart failure. Which interventions are appropriate? Thank you guys for following and sharing. Really appreciate. We're gonna upload this live also on Nursingy at YouTube, and we have uploaded all our previous live also. So make sure you search and watch those one also if you missed. Okay, come on guys. Now it's right-sided heart failure, and we are gonna do the interventions. Monitor daily weight. What about A? A, B, C, E, F. Yeah, nice guys. That's the one. That's correct. All of you guys are correct. Okay. Now we are not having right ventricle can't pump enough blood into the lungs, so we are having more accumulation into the systematic circulation. So monitor daily weight. Is it gonna help us? Yeah. Likewise, we discussed before, it's gonna give us how much fluid retention is happening over there. Okay, so daily weight is very important. Daily weight is very important. Restrict sodium intake. Why we need to restrict the sodium intake? Why we need to restrict the sodium intake, guys? Yeah, where sodium is high, water flow. We already having fluid overload in systematic circulation. We don't want more sodium and more water there, because otherwise it will keep increasing. And what about C? Dependent edema, especially in legs, ankle, sacrum. Yeah, we need to assess for edema, because now fluid is leaking. Yeah, okay, we need to check whether it's pitting, non-pitting, what's going on over there. So definitely monitor the edema. Encourage fluid to maintain hydration. Do we need to restrict the fluid, or do we need to encourage the fluid? Yes, Kyler, definitely do not encourage fluid. Okay, we need to have restrictor input and output. Yeah, restricted input, and we're gonna maintain, we're gonna watch, we're gonna monitor input and output level. Okay. Elevate legs when sitting. What about E? Is it gonna help us? Yes. Okay, this is the thing, this is the different thing in left sided and right sided, because now right sided can't pump enough, so we need to reduce pulmonary edema, and we can do that by elevating the legs when sitting. Okay. Yeah. Alrighty. So this is gonna help us with venous return. Thank you, Vinny. F. Monitor for ascites. Can there be accumulation of um, fluid in abdominal cavity? Yeah. This is one of the serious right-sided like sign of right-sided heart failure. Yeah. Somebody said why we need to restrict the sodium, because it will help to reduce the fluid accumulation in body. Okay, where sodium goes, fluid goes. If you are taking too much fluid, then it's gonna, yeah, then it's gonna happen. Jocelyn, no, you can't do that for left-sided, because you are having already pulmonary congestion, pulmonary edema in left-sided heart failure. So if you will increase the venous return, more fluid is gonna accumulated over there. Okay, especially semi-follower positions gonna help with that. We wanna reduce the pulmonary edema in left-sided. Alrighty. So F is correct, but we can, it's just bit opposite to each other. Yeah. Okay, question number 9, guys. Thank you everyone for double tapping. We are doing so good. A patient is receiving digoxin for heart failure, which assessment findings suggest digoxin toxicity. What kind of medication is digoxin? We done it before. We done it in last live also, and that's uploaded on YouTube already. What kind of medication and where it work? Cardiac, glyceride, yeah, yeah. What is the main site? And that's why we monitor so many things with digoxin. So guys, it work on sodium potassium pump in myocardial cells. Okay, just remember sodium potassium pump, because that's why when we need to monitor the potassium level, if it's very important with digoxin. Okay. Okay, let's do answers. A, bradycardia. Can we have bradycardia? Yes. This is one of the reason why we give to patient. We need to monitor. Okay, we definitely want to slow down the heart rate, but if it is going below 60, then that means it's digoxin toxicity. Okay, yeah, that means it's digoxin toxicity. So anything below 60, it is key sign. So please keep watching the heart rate on patient with digoxin. What about B, guys? Nausea, vomiting. Is it common? Is it side effects and toxicity? Yes. Yeah. Okay, because these are also GI tract side effect and early sign. These are very early signs of digoxin toxicity, so we need to watch that one too. And C, visual halos. What kind of halos, what color of halos we will see in digoxin toxicity? We done that before in last live. What color it is? Yellow? Yes, definitely green yellow. Okay. Patient can also experience blurred vision also, but like green or yellow halos are very key sign, classical, like patient definitely having the digoxin toxicity. Okay, hypertension. D. Thank you, Cindy. What about D, guys? No, because it's not toxicity. Yeah, okay. Digoxin toxicity typically cause bradycardia, like we discussed, and it can cause hypotension, not hypertension. Okay, yeah, yeah. Okay, so we are not gonna see D into that. And what about confusion? Is confusion correct? Yes, and because like confusion, fatigue, lethargy, these are key signs. Okay, we are not having enough blood to brain now. We are having hypotension, we are having bradycardia, and we are not getting enough blood to brain. Brain can't function properly, so that's why we are having confusion. What about tachycardia, guys? We can't have both, so tachycardia is definitely no. It's not sign of toxicity, so we will not worry about that. Okay, good review. We just done couple of days before pharma, so this is a good review. Okay, bradycardia, nausea, vomiting, visual halos, and confusion. Okay, this live will be posted on YouTube also. If you guys can search Narsingi and subscribe us over there. Okay, question number 10. So this live is all about cardiovascular medication, cardiovascular disease, cardiovascular nursing interventions. Okay, today we will do cardiovascular, and tomorrow we are gonna do renal. Okay, tomorrow we will do everything related to renal. So make sure you guys follow and share. Which patient teaching is appropriate for someone with chronic heart failure? Select all that apply. We are having chronic heart failure, guys, and we are just teaching. So make sure we answer according to that. A, B, C, D, F. Yeah, nice Sunflower, nice Winnie, good one. Okay, because it is one of the chronic lifelong condition, so we need careful self monitoring. So okay, wait daily is appropriate, definitely, because we already discussed about fluid retentions in heart failure, so this is the good one. Okay, report ankle swelling. What about B? Peripheral edema? Yes. Okay, if there is a peripheral edema going on, ankle swelling is sign of fluid overload. So we definitely need to report that, because this is typical sign of worsening heart failure. Limit sodium intake. What about C? We just discussed. We don't want more accumulation of water into the body, so we want to restrict the sodium intake. Yes. And what about D, guys? Report weight gain of 2 to 3 pound in 24 hours. This is very critical, because this rapid weight gain is not good. Okay, if somebody is gaining like 2 to 3 lbs in 24 hours, they need to seek immediate medical attention. Okay, so this is very important to teach to patient. D. Yeah. um yeah, too much weight gain. Double the diuretic if swelling worsen. Can weight double? Can patient adjust their dose by themselves? No. Yeah. Okay, I see all of the above in comments also before, but this is the thing, patient can't double it. Okay, patient need to come to provider and request for it. They need to report. Okay, take prescribed medication